Hello, everybody. Namaste. Today I'm here to talk to you about our this week topic, which is World Health Day 2025, and whose campaign title is Healthy Beginnings and Hopeful Futures. And I'm bringing a little bit of talk about women and girls in Nepal. Okay. So this is Okay, let me introduce myself first. If you're new here, welcome. Thank you so much for being here. Hello, welcome. Thank you for being here. So, I'm just introducing myself. My name is Ange or Anjali, if you like to call me. I'm from Nepal, originally from, and now I reside in beautiful Gold Coast. I have two beautiful children and amazing husband. So, yes, so today, I wanted to represent and be a voice for the women in Nepal on the topic of healthy beginnings and hopeful futures. Okay, so this year theme by World Health Organizations is a powerful reminder that every woman and every newborn deserves a chance, not just to survive, but to thrive. Okay, so I have written a little note around it. So I I feel a little bit heavy because as I was one of the three girls born as a girl, and we were called a cursed family because we didn't have a son. And it's not only that, but we went through a fair bit of diversity because just because we were girls, my other two sisters. Okay, so but anyway, let's go through this. The World Health Organization is calling on governments and the local health community to step up efforts to end preventable maternal and newborn deaths and to prioritize the long-term health and well-being of women before, during, and long after the childbirth. Okay, as someone myself born and raised in Nepal, this message resonates deeply with me. I come from a family of three daughters, like I mentioned already, in a society where sons are often favored. Our favored. Our journey wasn't always easy, but I was one of the fortunate one that my parents chose to educate me, to believe in me, and to raise me with the same hope they would give to any other kids. Okay, and that decision gave me a voice. Today, I use that voice to speak for the many women and girls who are still denied their most basic rights: the right to be born, the right to be safe, the right to be valued. Okay, so if you're just if you just come here, we are just talking about the World Health Day 2025 and campaign title Healthy Beginnings and Hopeful Futures for all the mothers and babies. Okay, thank you for being here. And so I was just talking about my story, a little bit of my story. And in Nepal, in some communities, the girls are still unwanted. Women are still pressured into gender selective abortions and early marriage, of course. I was just watching a documentary which was released 7 days ago. 14 years old girl got married and had a child. Okay, so it is still happening. And so these heartbreaking realities are not only cultural, they reflect a deep need for education, compassion, and systemic change. So this is not about blaming anybody, but this is about bringing the awareness, awakening, and action. It's about reaching into the heart of our families, okay? Families, schools, and healthcare systems, and planting seeds of respect and equality. So, because in olden days, we always said that, because the male will look after the parents and then the female will have to go away, and the family will have to provide a dowry and all those kind of things. It's still happening, and that is why the family dread to have too many girls, so otherwise they will have to give too many dowries, right? So yes, that is one of the example. And so we must create a world where every girl is welcomed with joy, every mother receives the care she needs, and no child is denied a future because of their gender. Okay. And to every parent, community leader, and health professional, it's a question, okay, to every one of us. Doesn't every child deserve an equal chance at life? Isn't every mother worth of safety and support? So this, for me, living here in Australia, it's a privilege, okay? It feels like it doesn't even exist, right? And for being here and seeing what's happening in Nepal and places like Nepal, it breaks my heart because I have been there, I have seen it firsthand, what and how women, what they go through, right? So that is why I would like to amplify their voice, to be able to live, to be able to be born, and to have that opportunity in life. So let's arise together, not just to celebrate women and girls, but to protect their right to exist, to be healthy, and to dream. Thank you. I would like to thank you to World Health Organization for shining a light on this vital issue. Let us use this moment to amplify the voices of mothers and newborns everywhere, ensuring that every birth is the beginning of hopeful future. On a hopeful note, published by Nepal newspaper, the Rising Nepal, on this World Health Day, Nepal celebrates a remarkable public health achievement. According to a United Nations report published by the Rising Nepal, the country has reduced maternal mortality by more than 70% since 2000. That is incredible. Nepal's maternal mortality rate now stands at 142 per 100,000 live births, a significant milestone and one of the most notable improvements in the region. Okay, and if you like to read the full article around it, I'm going to put the link in our content. Okay, so this progress is powerful reminder that change is possible with education, collective effort, and unwavering commitment to protecting every life. But let's continue this change together because there is still so much more to do, okay? And we cannot see every one of those people in the data, okay, in that little space where people are seeing them as a number and collecting them, okay, but there are so many people who needs that care and who needs the remind, who needs that voice, okay. So there are so many real stories, silent struggles, and invisible gaps remain. So together we can reach through them. Okay. So, my friends, hopefully this little reading of what I had gathered yesterday brings some light in, in a perspective of how much work we still have to do regarding mothers and bubs and the equality. Okay, so yes, comment down below what you think of it. It's a very heart touching topic for me. I wasn't going to do it, but I have to get out of my comfort and be the voice for them who doesn't have. Okay. And thank you for your support. And I am forever grateful for listening and, yeah, being here. Okay. And yes, thank you so much. You have a great afternoon, and let's bring the change and continue with healthy beginnings and hopeful futures for all the newborn and every mother. Okay. Thank you so much, my friends. You have a great day. Bye.